Gynera Tablet. Gynera tablets are commonly used as a combined oral contraceptive pill. They are used to prevent pregnancy by inhibiting ovulation, thickening cervical mucus to prevent sperm from reaching the egg, and altering the uterine lining to make it less suitable for implantation of a fertilized egg. In addition to contraception, Gynera tablets may also be used to regulate menstrual periods, reduce menstrual cramps and pain, and treat conditions such as acne and hirsutism, excess hair growth. Some women may also use Gynera tablets to manage symptoms of premenstrual syndrome (PMS) or polycystic ovary syndrome (PCOS). Gynera tablet daily dose. The typical dose of Gynera tablets is 1 tablet taken daily at the same time each day for 21 days in a cycle, followed by a 7-day break when no tablets are taken. It is important to follow the dosing schedule provided by your healthcare provider to ensure effectiveness. Contraindications of Gynera tablet. Contraindications for Gynera tablets include: 1. History of blood clots. 2. Cardiovascular disease. 3. Liver disease. 4. Breast cancer. 5. Undiagnosed vaginal bleeding. Side effects of Gynera tablet. Some common side effects of Gynera tablets may include: 1. Nausea. 2. Headaches. 3. Breast tenderness. 4. Weight gain. 5. Changes in menstrual bleeding patterns. 6. Mood changes.